Dr. Adjoa. I'm a board-certified psychiatrist, lifestyle medicine physician, and immunologist, and I'm here to talk to you today about serious mental illness. What is serious mental illness? Let's take a step back and talk about mental illness, which is a disruption in your emotions, your thinking, your behavior, cognition. But then when we talk about a serious mental illness, we're talking about further impairment that impacts your day-to-day life, your ability to function in society. I know a lot of us have heard the terms maybe high functioning and low functioning, and particularly when we talk about depression. So people might say someone has high functioning depression, meaning they're sad and they're still able to go to work, they're still able to take care of their kids or elderly relatives, do things that they need to do, and no one would even know that they are depressed. Then think about low functioning. We're like, oh wow, everyone notices low functioning depression. They're not getting out of bed, they're not dressing, they're barely eating, they're not keeping up with their responsibilities. And so when we talk about serious mental illness, we're talking about people that are suffering from an illness and they're on the lower functioning spectrum, meaning they're not able to do the things that they need to do. So what are some examples of serious mental illness? We classically think of schizophrenia, bipolar disorder, major depressive disorder, but it can also include any other mental illness where you're just not living up to what you normally would be able to do. So that can include OCD, that can include anxiety, PTSD, substance use, anything like that. So some common features of a serious mental illness in a person can be that they isolate a lot, they're distrustful, they may not be able to keep up with their hygiene or even keep their place of living clean, they may not be able to hold a job. They can have some psychotic experiences where what they believe is happening isn't really happening. All of these things are what can happen in a serious mental illness. The good thing to know is that even if you have a serious mental illness or someone that you know has a serious mental illness, there is help and treatment available. If you are getting treatment and help earlier, the better, and the less severe your symptoms can become. I want to talk to you a little bit more about the 3 serious mental illnesses that we typically see and think of that really do tend to incapacitate people, which includes schizophrenia, bipolar disorder, and depression. So what is schizophrenia? Schizophrenia is a disorder where your perception of reality is distorted. And it's also, to a certain extent, a cognitive disorder where your thinking is disrupted. A lot of times in schizophrenia, people might have delusions, they may have hallucinations, they may have an inability to really care for themselves, like keep up with their hygiene, they may forget to eat or not eat as frequently, they can have periods of time when they do isolate more and more. And this is typically one of the worst forms of serious mental illness that we see, and that individuals need a lot of help. And the reason why this gets to a point that is really, really bad for a lot of people with schizophrenia is that in the illness, you actually might lose insight into the fact that you are sick. That is a very classic hallmark, and so an individual with schizophrenia may not even go to get help. When you don't know that you're sick, you don't go to get any help, you just get sicker and sicker and sicker. And so that's why it's very important for an individual that has schizophrenia that they have support around them. So even at those times when they may not know that they're sick, somebody else can help them. When we think of major depressive disorder, a lot of us know what it feels to be sad, to feel hopeless at times, to be tired. But with major depressive disorder, this is a feeling that is lasting several weeks and is getting to the point where you are not able to do the things that you would normally do. You might be staying in bed longer, you might be sleeping longer, you may not be eating as much or overeating. There are many things. Some people might even lose the will to live. So then the other disorder that I want to talk about is bipolar disorder. Bipolar disorder is when you have episodes of depression, but you also have episodes of hypomania or mania. Now, a lot of times people are described as being bipolar because they have mood swings. Let me tell you, having mood swings, as we typically think of it, is not really bipolar disorder. That could be just someone reacting to what is happening in the moment. It could be a feature of another disorder like a personality disorder, most commonly by borderline personality disorder, and I can definitely talk more about that. Let me know in the comments if you want to learn more about the difference between borderline personality disorder and bipolar disorder. But mood swings that happen within a couple of minutes, someone's happy, then angry, then gets back to you and they're fine, and then they go throughout the rest of their day, that's not bipolar disorder. Bipolar disorder are periods for long periods of time, days to weeks, of when you're having periods of depression or periods of mania. So we already talked about depression. What does mania look like? Mania, one of the classic symptoms is lack of sleep. Almost every single patient that I have ever seen that is in the midst of a manic episode is not sleeping a lot, not sleeping consistently, but they still have a lot of energy. Other features of bipolar disorder include having this sense of invincibility. You might take more risks. You might be more irritable. Some people are super elated, super happy, giving everyone's hugs, high five. People might become delusional, even think that they are the president when, we only have one president here, but they might think that they are a ruler. They might think that they have special powers. They might have racing thoughts. There's so many other things that can happen. And again, these periods of mania last for days to weeks at a time. Most classically, people might be described as acting erratic. And so when you hear somebody describing someone's behavior as erratic, it could be an indication that they're in the midst of a manic episode, although you definitely have to know what the behaviors are. However, with bipolar disorder, the mania period does wear off. You might have a period of time where you are perfectly fine for several weeks, days, months, even years, and then you can have some depressive episodes that last for several weeks or months. And I find when I talk to some patients, their depressive periods are a lot lower and a lot deeper than even someone that has just depression on its own. But now to take it a step back, we've talked about depression, we've talked about bipolar disorder, we talked about schizophrenia. Like I said, there are many other disorders that can be classified under a serious mental illness. It's really about how you are functioning. That's how we then categorize it. So if someone has PTSD and they're not able to get out to be around other people because of symptoms of their PTSD, that is a serious mental illness in that person. Even some of the anxiety that can be crippling, where they might have agoraphobia, can't get out of the house, that can be a serious mental illness because it has totally incapacitated them where they can't get out, they can't work, they can't see people. But again, like I said at the very beginning, there is help available. So what is some of that help? Some of it is seeing a licensed mental health professional, whether that's a psychiatrist, a therapist. There might be times where you have to be hospitalized. There might be times where you are seeing them on a regular basis, which is the best way to talk about your symptoms. Sometimes medications might be prescribed. Very often they are in the cases of serious mental illness. There are other forms of support that can be lent. Sometimes people might need help in getting jobs and getting the skills for jobs, job placement. Firms can help with that, or programs that definitely help you build those skills. People might need help with learning how to even engage with other people. And that often is something that with people that have the early signs of schizophrenia, that is something that is incorporated into their treatment, learning how to socialize and be around people in what we would call a normal way. Other support that people might need is maybe coordinating things. It's a lot for the everyday average person to schedule their visits to a doctor, but you might need some more help with that. So maybe you have a case manager, a social worker that can help you with that. Some people might even need help to live, and that might mean living in supportive housing, where there are people, where you have your own room, you might have a roommate, but there are also people at your residence that are able to help you. Remember to help you with your meals, help you with your cooking, help you with reminding you to take your medications. Some people just need a little bit more support, and that is completely okay. It's important to remember with serious mental illness, you or your friend, your loved one can live a very well-fulfilled life, enrich, contribute to society, do all the things, but it is important to get help early and consistently. I hope this helps you understand a little bit more about what we talk about when we mean a serious mental illness. It just means that some people are suffering a little bit more with the symptoms. They might need a little bit more help. But with all of that, help is always available. I'll leave some resources in the comments section so you can check them out. And I hope that this video was helpful for you. Please remember to like, comment, share, and subscribe. And I'll see you another time. Bye, friends.